Thank you so much. All too soon, it is my own turn to be on the stage to share with you my presentation on HIV status awareness among HIV key and vulnerable population in Sub-Saharan Africa. This was a systematic scrutiny review study. My name is Clement Avoka. I'm from Ghana and currently live and work in the United States. This is going to be my presentation outline. Introduction. We know that HIV remains a major global public health challenge, and we have significantly high, numbers of people living with HIV with, new infections. For instance, the WHO estimated that 42.3 million deaths were recorded in 2022, and 39 million people were living with HIV worldwide. Sadly, Sub-Saharan Africa bears the highest burden of these cases, 67% of the global cases. That constitutes about 26.7 million people. Many countries with, generalized HIV epidemic focus, the control or the intervention measures on the general population instead of the key and vulnerable populations that are the main drivers of this epidemic. Even in countries with concentrated epidemics, they're still hesitant to implement necessary interventions. HIV key and vulnerable population remain underserved, impacting progress towards the global HIV goals. Okay, sorry about that. I think that I have done an edit to my slides, and I was expecting the new one to be projected, but this is the old one. I'm going to try my best and then know exactly what I want to say as far as this presentation is concerned. 1.3 million new infections, as I said earlier, in 2022. And women and girls accounted for about 44% of these new infections. Their key and vulnerable populations and their network drive the epidemic, as I said earlier. Literature reviewed assessed progress towards the 95 UNAIDS target. This target was set for the 1990 in 2014 and re-updated in 2021 for 95. So what that means is that by 2030, 95% of individuals living with HIV should know their status. And 95 of those who are diagnosed should be on treatment. And 95 of those on treatment should achieve viral suppression. Unfortunately, HIV testing is the main, it serves as the entry point to the HIV treatment cascade. And if we have some section of the population that are being neglected, interventions are not properly prioritizing them because of their nature, then I questioned this ambitious target to achieve, epidemic free by 2030. So it is therefore very important that the HIV response or interventions have to be very holistic enough to prioritize the HIV key and vulnerable populations in Sub-Saharan Africa. The problem statement. So, like I said earlier, despite efforts that have been made, globally and in Sub-Saharan Africa to control the HIV epidemic, about 5.4 million people worldwide were unaware of their HIV status in 2022. And key and vulnerable populations are 13 to 22 times more likely to contract and spread HIV/AIDS. And that is why it is very important that we prioritize them, you know, in the HIV interventions. For instance, 80% of young women living with HIV worldwide resides in Sub-Saharan Africa. That is huge, right? And new infections are often linked to individuals unaware of their HIV status. And barriers to HIV testing and care in Sub-Saharan Africa included stigmatization and discrimination, limited access to services, you know, by key and vulnerable populations, and structural and policy barriers were also reported in some of the studies. The study objective was to explore existing literature on HIV status awareness among key and vulnerable populations in Sub-Saharan Africa, identify gaps in the literature, and describe the scope of available evidences. This was the conceptual framework that was used to describe the relationship between the dependent variables and the independent variables that would contribute to us achieving the 95-95 target by 2030. The significance of this study, of course, a study of this nature would help to map evidence on the level of progress towards achieving the UNAIDS first 95 of the 2021 updated target. The findings will inform decision on the feasibility of achieving this goal by 2030. Identifies the literature gaps to guide future research and policy development in this field. And lastly, policy makers such as the Minister of Health and key stakeholders who are interested in HIV epidemic will find the insights very valuable in shaping evidence-based interventions and policy. Now, the method, like I said, this was a scoping review study that charted literature from 2016 to 2022, following the PRISMA-P guideline, and was conducted in line with steps suggested by Ariske and O'Malley Framework 2005. The databases that were searched included PubMed, Google Scholar, ScienceDirect, and CINAHL. All studies were exported to the Mendeley Citation Manager, and our inclusion criteria was that studies that were done in Sub-Saharan Africa from 2016 to 2022, and those studies were focused on HIV status awareness or testing, or focused on the 95 or the 99 target. The screening process involved 2 independent co-screeners who reviewed the eligibility of the studies and charted the data. Where we had a discrepancy or disagreement, there was a third reviewer who reconciled, the discrepancy between these two reviewers. The framework we used was the population content and context, that is the PPC, which the population was the HIV key and vulnerable populations. The content was the HIV status awareness, and the context was the Sub-Saharan African countries. So we used the PRISMA-P flow diagram to present the screening results as follows. The electronic databases search using the keywords came up with 136 records, and other records also, identified 4 more articles. So after we have, screened them for duplicates, we deleted the duplicates and it came up to 131 articles. Then we conducted the abstract screening and further excluded 73 articles. Then 58 were assessed for full text screening, and we further excluded 26 articles. And the reasons were that 2 of the articles were protocols, and 14 of them presented no evidence involving key and vulnerable populations, and 6 of them presented no evidence on the HIV status awareness, and 4 were review studies. So finally, we came up with 32 studies that met the study inclusion criteria, and we extracted data from these 32 articles. From the 32 articles, our findings were as follows. We found out that about 65% of 0.5% of studies reported suboptimal testing or awareness of HIV status in Sub-Saharan Africa. The geographical coverage, we found out that only 14 out of 46 Sub-Saharan African countries had available data. And there was no evidence presented on other key populations like prisoners and drug addicts in Sub-Saharan Africa. And what were the barriers? The barriers included limited research, especially in Sub-Saharan Africa, especially in West Africa. And some studies also reported stigma, discrimination, and policy gaps in HIV testing. So if the 95-95 goal will be achieved by 2030, there has to be a different approach because many countries lag behind in achieving the target because interventions are concentrated or targeting the general population instead of these key populations. So self-testing was very promising in most countries that have started self-testing, but then they're still underutilized for that particular, method. Some challenges that were reported included low awareness and accessibility of testing services, stigmatization and discrimination against key populations, especially adolescents, and implementation barriers to HIV testing initiatives also were reported in some studies. We also identified gaps in research coverage across Sub-Saharan Africa. So based on the findings and the conclusions, these were the recommendations made. Self-testing initiatives should be adapted to improve HIV testing because HIV testing, like I said earlier, marked the entry to the HIV treatment cascade. And if we have a section of the population by virtue of their identity is limiting them from accessing testing, then where are we by 2030 to say that we're going to achieve, epidemic control for HIV? So self-testing is, very convenient, and that is able to protect the individual identity and minimize the stigmatization and discrimination to encourage them to actually, patronize testing. We also need to expand peer-led distribution of test kits. If we use the snowballing method, we will be able to distribute these self-testing kits among these populations. For instance, men who have sex with men, female sex workers, they are very convenient to share information among themselves. So if we are able to expand peer-to-peer distribution of these test kits, what it means is that we're going to promote the uptake of testing services among these populations. Then there's also the need to address stigmatization and discrimination through community-based interventions, such as health education, such as stakeholders engagement is going to help us to reduce stigmatization and discrimination among these groups. And there's the need for further research on implementation challenges in Sub-Saharan Africa, especially in the western part of Africa, where we found limited studies as far as HIV testing among key and vulnerable population was concerned. Conclusion. Limited evidence available across Sub-Saharan Africa, especially in West Africa. Suboptimal HIV testing persists among key populations. Innovative strategies like self-testing and peer-led interventions show promise and should be encouraged. Further research is essential to enhance testing uptake and achieve the UNAIDS goals, and more research on other key populations like drug addicts and prisoners will be very essential in contributing to achieving this goal by 2030 in Sub-Saharan Africa. Acknowledgement. I have the singular honor to acknowledge my co-screeners and the professor who supervised this work, Dr. Desmond Coupel, and the IPHC organizers for the 2025 edition. Thank you so much for the opportunity to be here today and to share with you this piece of work. Thank you very much. I would like to invite your questions, comments, and contributions at this point.